everyone! Welcome to Tangerine Planet, a place for kind thoughts, smart ideas, and a little sunshine for the world. Let's make a difference, one step at a time, together.
Can something as, ordinary as every day as the temperature outside actually be linked to something as incredibly difficult, as tragically complex as suicide? It feels counterintuitive, right? Like weather is just too simple a factor for such a deeply personal and multifaceted human crisis. But that surprising, even challenging question is exactly what a recent piece of scientific research set out to investigate.
It's a question with some really profound implications, especially, as we grapple with the realities of a changing climate. Welcome to this deep dive. Today, we're pulling back the curtain on a fascinating study that looks at this very connection.
Yeah, our source material for this deep dive is a paper published just recently, actually, in the May 2025 issue of the journal Environment and Health. This research really drilled down into data from Thailand, specifically looking at two very different provinces, Chiang Mai and Bangkok, to explore the relationship between ambient temperature and the risk of suicide.
Right. The researchers had a pretty clear mission, and it's basically our mission today as well, to figure out if this temperature-suicide link holds true in a tropical climate like Thailand's, and then to understand the magnitude of that connection and to try and, quantify what percentage of suicides might potentially be influenced by temperature in these regions. Ultimately, we want to extract the most important findings, understand how they arrived at them, and discuss what this could mean for understanding and maybe even addressing suicide risk in the context of a warming world.
So you've shared this paper with us, and our job really is to be your guides today, to help you navigate this research, pull out those essential nuggets of knowledge, and understand why it all matters. Let's jump in.
Okay, sounds good. Let's maybe set the global stage first. Suicide is, unfortunately, a major public health crisis worldwide. The statistics are just heartbreaking. The World Health Organization estimates over 700,000 suicides occur globally each year.
Wow, over 700,000. That's a truly staggering number, like a silent pandemic happening all around us. And it hits young people particularly hard, doesn't it? I think I read that in 2019, suicide was the fourth leading cause of death globally for individuals aged, 15 to 29?
Exactly. That's right. And there are these persistent patterns globally when we look at demographics. In 2019, for example, the age-standardized suicide rate was notably higher for males compared to females, something like 12.6 deaths per 100,000 males versus 5.4 per 100,000 females.
Okay, so that's the global picture. Where does Thailand fit into this?
Well, Thailand, located in tropical Southeast Asia, unfortunately, has a relatively high suicide rate compared to some of its regional neighbors. In 2020, the national rate was reported at 7.8 per 100,000 population. And like the global trend you mentioned, the majority of suicides in Thailand are among men. The source notes that between 2013 and 2019, about 80% of completed suicides were by males.
80%, wow. And the average age?
Around 45 years. And concerningly, the study also highlights an increasing trend in the overall suicide rate in Thailand between 2013 and 2019, which, makes research into any contributing factors even more critical.
No, it's absolutely essential to acknowledge right up front the profound complexity of suicide. We are talking about something that is never attributable to just one single cause. It involves this deeply intertwined mix of, biological factors, psychological states, personal histories, social circumstances. The list goes on.
You've hit on the crucial point there, and this research doesn't in any way suggest that temperature is the cause of suicide. Not at all. Instead, it explores the idea that environmental factors, like ambient temperature, might act as an additional stressor, or maybe a contributing piece in that incredibly complex puzzle, potentially interacting with those pre-existing vulnerabilities to increase risk for some individuals.
Right. We've sort of heard whispers of this link before, haven't we? Studies suggesting a connection between hotter temperatures and increased suicide risk, maybe especially outside the tropics?
Yes, absolutely. The paper points to existing literature. There was a meta-analysis they cite which found a small, but importantly, statistically significant increase in risk. I think it was a relative risk of about 1.016 for suicides and suicide attempts per 1 degree Celsius increase in temperature.
Okay, small but detectable.
Yeah. And another larger multi-country study found a relative risk of 1.33 when comparing the highest temperature percentiles globally to the lowest. So the idea isn't entirely new, no.
But here's the twist, right? And the reason the study in Thailand is so important, most of that evidence we just talked about comes from temperate climates, places outside the tropics.
Exactly. And that's the significant knowledge gap this research specifically targets. Previous studies looking at this in tropical regions, places like the Philippines or Vietnam, had results that were either, well, unclear or maybe based on more limited data. It made it hard to draw firm conclusions for these parts of the world.
And why is that gap so critical now?
Because tropical regions are projected to experience some of the most severe health consequences from climate change, including significant increases in temperature extremes. So understanding how heat might influence suicide risk within these potentially vulnerable regions is absolutely crucial for proactive public health planning in the coming years. It's really important work.
Okay, let's unpack this idea a bit more then. How could temperature, this seemingly external thing, actually get under our skin, so to speak, and influence something as internal as suicidal thoughts or behavior? Are there plausible biological or psychological pathways, the science suggests?
Well, the paper touches on some proposed mechanisms, acknowledging, like we said, that the link is likely complex and multifactorial. It probably involves interactions with other individual vulnerabilities. One idea is related to how heat affects our nervous system. They suggest that high temperatures might lead to disruptions in neural activity, maybe causing overstimulation in heat-sensitive areas of the brain. And this, in turn, could potentially worsen existing symptoms of anxiety or depression, or maybe even trigger them in people who are susceptible.
That makes a certain intuitive sense, doesn't it? I mean, extreme heat can definitely make you feel agitated, uncomfortable, even distressed. That could certainly put added strain on someone already struggling with their mental health.
Right. And another really well-established link is between high temperatures and sleep disturbances. We all know how hard it can be to sleep when it's really, really hot. And the science is pretty clear. Sleep problems are strongly associated with poorer mental health outcomes. That includes increased risk of depression, anxiety, and crucially, suicidal behavior.
Okay. So lack of quality sleep impairs cognitive function, emotional regulation.
Exactly. It can amplify feelings of hopelessness. So that's a clear potential pathway. Heat disrupts sleep, and disrupted sleep worsens mental health.
Makes sense. Any other mechanisms?
Yeah, a third one they discuss is the potential influence of temperature fluctuations on neurotransmitters, specifically serotonin. Serotonin plays a key role in regulating mood, impulse control, and emotional stability. Some hypotheses suggest that changes in temperature might affect serotonin levels or its activity in the brain.
And lower serotonin has been linked to
Increased impulsivity and aggression. Factors that can sometimes be involved in suicidal acts, particularly, again, in individuals with underlying vulnerabilities.
So it's not like a simple A leads to B leads to C chain reaction. It's more like a series of ways temperature could interact with our physiology and our psychology, potentially amplifying stress, disrupting mood regulation, maybe affecting impulse control, all of which could, in turn, increase the risk for someone who's already struggling.
Precisely. It's really about how an environmental stressor like heat might push someone closer to the edge, especially when combined with all those other biological, psychological, or social factors that are already in play.
All right, let's get into the nuts and bolts of this specific study then. What were the researchers' precise goals, and what kind of data did they actually use to investigate this link in Thailand?
Okay, so the study outlined two main objectives. First, they wanted to rigorously investigate whether there's a detectable association between ambient temperature and suicide in the specific tropical climate context of Thailand, focusing on those two provinces, Chiang Mai and Bangkok. And second, if they found an association, they wanted to go a step further and quantify the actual public health burden. Basically, estimate what proportion of suicides in these regions could potentially be attributed to temperature.
And they picked those two provinces specifically because they offer an interesting contrast, right?
Yeah, exactly. Chiang Mai, up in the north, is the largest province in that region. It has a tropical climate, but it's generally perceived as being slightly cooler and less humid than Bangkok, especially during the cool season. Bangkok, the capital, down in central Thailand, is this massive, densely populated metropolitan area, also tropical, but known for its pretty consistent heat and high humidity.
And their suicide rates were quite different too, weren't they? That adds another interesting layer.
They were, yeah. It adds another layer to the analysis, definitely. In 2020, Chiang Mai had a relatively high suicide rate of 14.7 per 100,000 population, significantly above the national average. Bangkok, maybe surprisingly for a major capital, had a lower rate of 4.3 per 100,000 in the same year. Studying these two different environments, different population densities, helps explore if location-specific factors might play a role in how temperature affects suicide risk.
Okay, so what kind of data did they actually get their hands on for this deep dive?
They used a really comprehensive data set covering a 20-year period from January 1st, 2002 right up to December 31st, 2021. This included daily counts of completed suicides for both provinces, which they got from the Ministry of Public Health. These suicides were classified using the standard system, the ICD-10 codes, which is the global standard for classifying causes of death. They also broke down the suicide data by sex and age, which allowed for more detailed analysis later on.
And the weather data.
Alongside the health data, they obtained daily meteorological data, so minimum and maximum temperatures and relative humidity from the Thai Meteorological Department.
And how did they boil down the daily temperature into like a single number for their analysis each day?
Good question. They calculated the daily mean temperature simply by averaging the minimum and maximum temperatures recorded for each day. For Bangkok, because it's such a sprawling city, they used data averaged across 4 different weather stations to try and get a better representation of the temperature experienced across the area. For Chiang Mai, though, they primarily relied on data from a single main station. The reason being the only other available station was in a very remote, mountainous area that just wouldn't be representative of the temperature experienced by most of the province's population.
Okay, makes sense. Now for the method. Analyzing how daily temperature fluctuations might affect daily events like suicides over such a long period, that sounds statistically tricky. How do they tackle this?
They employed a pretty sophisticated technique, actually. It's called a time-stratified case crossover analysis, combined with something called a distributed lag nonlinear model, or DLNM.
Okay, that sounds complicated. Can we break that down a bit? Case crossover.
Yeah, let's try. The case crossover design is really quite clever. Basically, you imagine each person who died by suicide serves as their own control. So, for the specific day the suicide occurred, that's the case, they compare the temperature and humidity on that day to the temperature and humidity on a set of control days selected for the same individual.
Ah, okay, so it's like comparing the weather on the day someone died by suicide to the weather on, say, other Tuesdays in the same month and year, but for that exact same person.
Exactly, you got it. By comparing within the same individual's timeline, this method inherently controls for all the stable characteristics of that person. Their genetics, underlying health conditions, socioeconomic status, things that don't change day to day. It also controls for things that change slowly over time, like seasonal patterns or long-term trends in suicide rates. Because the control days are chosen from a really tight window, around the case day, same month, same year, same day of the week. This really helps isolate the specific acute effect of daily environmental factors like temperature and humidity.
Okay, that makes sense. And the second part, distributed lag nonlinear model, DLNM.
Right, DLNM. That part handles 2 key things. Nonlinear means it doesn't assume the relationship between temperature and risk is just a straight line. It can capture curves, like maybe the risk accelerates rapidly only at very extreme temperatures. And distributed lag means it can account for the fact that the effect of temperature might not be immediate. Maybe the stress of a really hot day only increases someone's risk a day or 2 later. The model can estimate effects that are distributed over several days. In their main analysis, they primarily looked at lags up to 2 days. So they considered the impact of temperature on the day of the suicide and the 2 days immediately preceding it.
And they also adjusted for humidity and public holidays, you mentioned.
Yes, absolutely. They included relative humidity in the model to control for its potential confounding effect, because humidity really influences how heat feels and impacts the body. They also adjusted for public holidays, as these days might have different social dynamics or routines that could influence suicide rates independently of just the temperature. They ran the analysis for each province separately first, and then they used a statistical method, basically meta-analysis, to pool the results together, creating an overall estimate for the whole study region, Chiang Mai and Bangkok combined.
And beyond just finding if there was a link, they aimed to put a number on its impact, that attributable burden. How did they calculate that?
Right, the attributable fraction. Think of this as estimating the proportion or percentage of suicides that could be statistically attributed to temperature as being different from the temperature associated with the minimum risk of suicide. They call that the min-steed. It's essentially an estimate of how many suicides might not have occurred if the temperature on those days had been at that identified lowest risk level.
Okay, so they're basically asking, based on our statistical model, what slice of the observed suicides seems statistically linked to the temperature conditions, especially those temperatures that are, outside the ideal range?
Precisely. And to refine this even further, they categorized temperatures into 3 ranges based on percentiles. Cool, which was 0 to the 33rd percentile, warm, 34th to 66th percentile, and hot, 67th to 100th percentile. This allowed them to see how that total attributable burden broke down across different levels of heat. Was it mostly the really hot days, or did warmer days contribute too?
All right, enough about the methods, fascinating as they are. Let's get to the results. What did this study actually reveal about the temperature-suicide connection in Thailand?
Okay, results time. First, just a snapshot of the data itself. Over that 20-year study period in Chiang Mai and Bangkok combined, there were a total of 8,472 completed suicides recorded. As we mentioned earlier, the vast majority were male, 78.9%, and most were in the 0-64 age group, that was 88.0%. The average daily mean temperature across this entire period was 28.5 degrees Celsius, definitely reflecting the tropical climate. And the average relative humidity was quite high, 71.2%.
And did they see any patterns just looking at the raw data across the year?
They did, yeah. The raw data showed some pretty clear seasonality. Suicide peaks typically occurred during the hot season, which is roughly March to May in Thailand, and these peaks often continued into the wet season, June to October. Then the numbers tended to drop off during the cooler months, November to February. So this initial look already kind of hinted at a potential temperature link even before they ran the sophisticated models.
Interesting. So what did the rigorous analysis show then? What was the main association they found between temperature and suicide risk?
Looking at the pooled data, combining both provinces, the model revealed a clear positive association. The relationship was described as mostly linear. That means the risk generally increased steadily as the temperature rose, although the increase seemed to become particularly pronounced at the higher end of the temperature spectrum they observed.
Was there a specific temperature they identified as having the absolute lowest risk, the MINST?
Yes, based on the pooled data, that minimum suicide temperature, or MINST, was estimated to be around 20.7 degrees Celsius. And the temperature representing the highest risk in their range, which was the 99th percentile of temperatures they observed, was around 33.3 degrees Celsius.
Okay. And what was the relative risk across that temperature range, from the lowest risk point to the highest?
Right. This is a core finding. The pooled relative risk, or RR, across that studied temperature range was calculated to be 1.70, and the 95% confidence interval for that was 1.35 to 2.15.
Okay, let's make sure we really grasp this. An RR of 1.70, what does that mean in simpler terms?
It means that, based on this model, the risk of suicide at the very highest temperatures they observed, around 33.3 degrees Celsius, was estimated to be 70% higher compared to the risk at the temperature associated with the lowest risk, around 20.7 degrees Celsius. And the fact that the confidence interval with that range of 1.35 to 2.15 doesn't include the number 1.0 is statistically significant. It tells us this isn't likely just a random fluctuation. There's a real detectable increase in risk associated with higher temperatures in this data set.
Wow. So significantly hotter days were linked to a significantly higher risk of suicide in these regions of Thailand. Did they see this pattern differ much between Chiang Mai and Bangkok?
They did look at that. When they analyzed the provinces separately, Chiang Mai actually showed a higher relative risk, an RR of 2.05 compared to Bangkok, which had an RR of 1.48. This suggests the association might be stronger in Chiang Mai. Maybe the population there is more sensitive to temperature increases. However, and this is important, statistically, the confidence intervals for the two provinces significantly overlapped. So based on this specific study, they couldn't conclude that this difference in RR was statistically significant. It's an interesting observation, but one that needs more research to confirm.
Okay, so a potential hint of a difference, but not statistically proven here. What about differences based on sex and age? Any clear findings there for relative risk?
They analyzed these subgroups as well. For sex, when they pooled the data, the relative risk for females was actually slightly higher, at 1.98, compared to 1.64 for males. But similar to the province comparison, the confidence intervals for males and females overlapped substantially in the pooled analysis. So again, they couldn't conclude that the temperature-suicide association was statistically significantly stronger for one sex over the other based on the overall pooled data from this study. The picture was also a bit inconsistent when looking at provinces separately. Females showed a higher RR in Chiang Mai, while males showed a higher, though less precise, RR in Bangkok. The estimate for females in Bangkok was quite uncertain because of smaller numbers.
Okay. And age?
For age, the pooled RR for the 0-64 years group was 1.83, which was higher than for the 65 years and older group, where the RR was 1.02, basically suggesting little association in that older group across the range. But again, the confidence intervals overlapped when pooling the data. So the difference in relative risk between these two age groups across the full temperature range wasn't statistically significant overall. Province-specific results for age groups showed pretty similar trends.
Okay, so the relative risk analysis shows a clear overall link between temperature and suicide risk, but the subgroup comparisons for sex and province didn't show statistically conclusive differences in the strength of that association. However, the study also looked at attributable burden, which tells a slightly different story about the overall impact, doesn't it?
It does, exactly. And this is where one of the most impactful findings emerges, particularly regarding age. Remember, the attributable fraction is about the proportion of suicides potentially linked to temperature at the population level, not just the relative risk increase.
Right, the estimated percentage of suicides that might not have happened if temperatures on those days had been at that minimum risk level. What was that overall number?
This is really the headline finding regarding the impact. Overall, for the pooled data from Chiang and Bangkok, a substantial 24.61% of suicides were estimated to be attributable to temperature. The 95% confidence interval for this estimate was pretty wide, but clearly above zero, ranging from 10.78% to 34.68%. This indicates the finding is statistically robust. Temperature seems linked to a significant fraction of suicides.
Nearly a quarter, 24.61% of suicides in these regions potentially linked to temperature exposure. That's a really significant public health number. How did that burden break down across those temperature categories you mentioned, cool, warm, and hot?
Right. When they sliced the data by those temperature ranges, the majority of that attributable burden was linked to the warmer and hotter temperatures. The hot category, so temperatures above the 66th percentile, accounted for the largest single share, estimated at about 12.05% of all suicides. The warm category, the middle third, from 34th to 66th percentile, contributed another significant portion, about 8.35%. The cool category, temperatures below the 33rd percentile, contributed less, around 4.55%.
So the impact is definitely driven more by the higher temperatures, especially the hot ones. Did they see differences in this attributable burden across the subgroups like sex and age?
Okay, for sex, the pooled attributable fractions between males and females were actually very close, and there was no statistically significant difference found. So in this study, the estimated proportion of suicides attributed to temperature wasn't significantly different between the sexes at the population level.
Interesting. So while the relative risk numbers hinted at maybe some slight differences, the overall estimated impact, the attributable fraction, didn't show a significant difference between sexes here. What about age? Did that show a difference in burden?
Yes. This is where a clear and statistically significant difference emerged. The pooled attributable fraction for the 0-64 years age group was substantially higher, estimated at 29.26%. In stark contrast, the attributable fraction for the 65 years and older group was only 8.58%. And crucially, the confidence intervals for these two age groups did not overlap. This makes the difference statistically significant.
Wow, okay, that's a key finding then. It suggests that while temperature might play some role for older adults, its estimated impact at the population level, the proportion of suicides potentially linked to it, is significantly higher in younger adults and middle-aged individuals compared to older adults in this region.
Absolutely. It really highlights a particular vulnerability, it seems, in that working age population. When looking at the provinces individually, Chiang Mai had a higher estimated attributable fraction, around 27.97%, compared to Bangkok's 19.33%. But again, similar to the relative risk finding, this difference between provinces wasn't statistically significant overall when comparing their confidence intervals.
Got it. Beyond the overall association and burden, did they find anything interesting about the timing of the temperature effect? You mentioned lags earlier.
Yes. The lag analysis showed that the effect wasn't always immediate, and it seemed to differ slightly between the two provinces, which is interesting. In Chiang Mai, the increased risk associated with hotter temperatures appeared to be strongest on the same day as the temperature exposure, what they call lag zero. In Bangkok, however, the increased risk sometimes manifested with a bit of a delay, showing significant effects on lag 1 and lag 2 days as well, meaning 1 or 2 days after the hot day. This subtle difference in the lag structure hints that maybe the mechanisms, or perhaps the way people experience and respond to heat, might vary slightly depending on the local context or maybe patterns of exposure.
And how confident can we be in these overall findings? Did the researchers test how robust their results were to different assumptions?
They did, yes. They performed several sensitivity analyses. This is standard practice where they basically tweak some of the assumptions in their statistical model to see if the main results hold up. For example, they changed how they controlled for humidity. They considered longer lag periods going out to 14 days, and they used different mathematical functions to describe that temperature response curve. The good news is that the core association, they found that link between higher temperature and increased suicide risk, and the substantial attributable burden remained largely stable across these different tests. This suggests the main finding is pretty robust. However, they did note that when they extended the lag period significantly, out to 14 days, the precision of their estimates decreased. That means the confidence intervals got wider, leading to more uncertainty in modeling effects over those longer durations.
Okay, that's reassuring that the main finding held up. Let's move into the discussion part of the paper now. What do the researchers themselves believe are the key takeaways and the broader implications of these results?
Well, the most important conclusion they draw is that this study provides solid evidence confirming a positive association between higher ambient temperatures and increased suicide risk. And, crucially, it successfully extends this finding to a tropical setting like Thailand, where, as we discussed, previous research was less conclusive. This really fills a critical knowledge gap.
And they noted something interesting about the shape of the association, didn't they? That it was mostly linear and how that compared to other places.
Yes, that's an interesting point of comparison they raised. The nearly linear increase in risk with temperature found here in Thailand contrasts with some studies in other tropical regions like the Philippines or Vietnam, which had sort of unclear associations. It also contrasts with findings from some East Asian countries like Japan or South Korea, which often show a more nonlinear pattern, sometimes with like a J-shape or a threshold effect where the risk only jumps significantly after a certain high temperature is reached. The Thai finding was actually more similar in shape to associations seen in many Western countries. This highlights that even within Asia, or even just within the tropics, the precise relationship between temperature and suicide might vary, probably influenced by local factors like climate patterns, adaptation levels, maybe even sociocultural factors.
Okay, let's dive back into those potential reasons for the differences they hinted at between the provinces and subgroups. Why might Chiang Mai, despite being slightly cooler on average, show that potentially stronger relative risk or higher attributable burden compared to Bangkok, even if it wasn't statistically significant here?
Right, the authors offer a few potential explanations, drawing parallels with findings, for instance, in Japan, where populations in colder regions sometimes seemed more sensitive to heat waves than those in consistently warmer regions. One key idea could be climate adaptation. The population in Chiang Mai, experiencing somewhat cooler temperatures overall compared to Bangkok's relentless heat, might simply be less physiologically or behaviorally acclimatized to extreme heat events. So when a significant heat wave does hit, it has a proportionally larger impact on them.
Makes sense. Less used to it hits harder.
Potentially, yeah. Another significant factor they point to is disparities in urbanization and, crucially, access to mental health services. Bangkok, being the capital and a major metropolis, has considerably more mental health infrastructure and professionals per capita. The paper cites data showing Bangkok had nearly double the number of psychiatrists per 100,000 population compared to Chiang Mai province back in 2021. It's plausible that greater access to mental health support in Bangkok might help mitigate some of the temperature-related stress or the exacerbation of underlying mental health issues, potentially blunting the temperature-suicide association slightly compared to Chiang Mai, where access might be more limited.
And that third factor you mentioned earlier, occupation, how might that play into the Chiang Mai versus Bangkok difference?
Right. Chiang Mai province has a higher proportion of its population engaged in outdoor occupations, particularly agriculture, compared to the more service-oriented, largely indoor urban economy of Bangkok. People working outdoors inevitably face much more direct and prolonged exposure to high ambient temperatures. This increased occupational heat stress could certainly contribute to a higher temperature-related suicide risk in Chiang Mai, and it also ties into that striking age finding we discussed.
Yeah, let's talk more about that. The finding of a statistically significantly higher attributable burden in the 0-64 age group compared to older adults seems really important. Why might that be?
This is definitely one of the study's key novel insights, I think. As we discussed, that 0-64 age group largely corresponds to the working age population. The authors propose that occupational heat exposure is a very plausible explanation for this higher burden. Individuals in this age range are simply more likely to be employed. And many jobs, especially in a tropical country like Thailand, think agriculture, construction, fishing, even informal sector work like street vending, involve significant time spent outdoors or in non-air-conditioned environments where heat exposure can be intense and prolonged. This aligns really well with those potential mechanisms we talked about earlier, extreme heat impacting stress levels, cognitive function, sleep quality, maybe even serotonin, which could be particularly impactful for individuals experiencing this stress day in, day out as part of their work.
So it's not necessarily that older adults are somehow immune to heat's negative effects, but perhaps the specific context of heat exposure, especially prolonged occupational exposure, makes the working age group disproportionately vulnerable to this particular temperature-related suicide risk.
That seems to be the key interpretation emerging from that finding, yeah. Older adults might spend more time indoors, perhaps have different daily routines, potentially reducing their direct, sustained exposure to the most extreme ambient heat compared to those who have to work through it.
And what about the sex difference finding, or rather, the lack of a statistically significant difference in attributable burden in this study? How does that fit with other research?
That's also worth noting. Some studies, particularly in Western countries and parts of Latin America, have found a stronger temperature-suicide association in males. This is often linked, as you might expect, to their higher representation in outdoor manual labor occupations. However, other research, particularly in East Asia, has sometimes suggested females might be more sensitive, maybe due to different physiological responses or social roles. The fact that this study in Thailand didn't find a significant difference in attributable burden between the sexes, despite males comprising the vast majority of suicides overall, really highlights that the sex-specific relationship with temperature isn't universal. It seems heavily influenced by regional environmental factors, cultural norms, and crucially, the specific occupational context for both men and women in that location.
Okay. Bringing it back briefly to those hypothesized mechanisms, serotonin, stress hormones, sleep disruption, do the overall findings from this study offer any indirect support for them?
Well, look, this type of ecological study can't directly prove those biological pathways are happening in individuals. That would require different kinds of research. However, the observed association, particularly the clear increase in risk at higher temperatures and that significantly higher burden found in the working age group, is certainly consistent with those proposed mechanisms. We know intense heat is a physiological stressor. We know it disrupts sleep and stress hormones. And there's laboratory evidence suggesting impacts on neurotransmitters like serotonin. So the population-level findings make those proposed biological pathways seem more plausible as contributors to the effect we're seeing.
And that overall attributable fraction, that nearly 25% number, what does that really mean for public health planning, especially looking ahead with climate change?
It means that temperature is not some negligible background factor. It's potentially contributing to a really significant portion of suicides in this region. This has major implications, particularly when you consider climate change projections, which predict more frequent, more intense, and longer-lasting heat waves in tropical areas like Thailand. The fact that nearly half of that attributable burden in the study was specifically linked to hot temperatures, the upper third, really underscores the urgency. It strongly implies that as average temperatures rise and heat extremes become more common, we could potentially see an increase in this specific temperature attributable component of suicide risk, adding to the overall burden.
Okay. What did the researchers themselves highlight as the key strengths of their study? What makes it valuable?
They pointed out several important strengths. First, it's the first dedicated study to really investigate this association in Thailand, using robust methods. They used a large, comprehensive data set covering 20 years from two major contrasting provinces. They employed that very sophisticated statistical methodology, the time-stratified case crossover with DLNM, which is really well suited for analyzing the acute effects of environmental factors like temperature while controlling for many potential confounders, including individual characteristics and time trends. And, crucially, they were able to quantify the attributable burden. That gives us a concrete estimate of the potential magnitude of the impact, which is so vital for informing public health policy and resource allocation.
Right. And like any good scientific paper, they were also upfront about the limitations. What were the main ones they noted?
Yeah, absolutely. They acknowledged first that this is an ecological study. It uses population-level data, daily counts of suicides, and average daily temperatures for a province. Therefore, it can show an association at the population level, but it cannot establish causality for any individual case. It doesn't prove that temperature caused any single suicide.
Okay, important distinction. What else?
Another limitation relates to the exposure data, the temperature itself. Using data from central weather stations is standard practice in these studies, but it might not perfectly capture the individual heat exposure for every single person in the study population. People spend time indoors, outdoors, in air conditioning, in direct sun. That individual variation isn't captured. This could introduce some degree of measurement error. And as we mentioned, the reliance on just one main weather station for the vast Chiang province is a practical limitation that might miss some local microclimate variations within the province.
And the suicide data itself.
Yeah.
Any potential issues there?
Well, relying on official death certificates for classifying suicides, even using the standardized ICD-10 codes, always carries a potential risk of misclassification or underreporting. Suicide, unfortunately, still carries a significant stigma in many societies, which might lead families or officials to classify a death differently. Or, sometimes, determining intent definitively can be difficult. This is a common challenge in suicide research globally, not specific to this study, but important to acknowledge.
You mentioned the uncertainty in some of the subgroup findings earlier, too.
Yes, exactly. For some subgroups, particularly females in Bangkok and older adults, those aged 65 and over in both provinces, the total number of suicide cases over the 20-year period was relatively low compared to, say, working-age males. This lower number of events naturally leads to wider confidence intervals and less precise estimates for the temperature association within those specific subgroups. So those particular results should be interpreted with a bit more caution.
And were there any other major environmental factors they didn't include in the analysis?
They specifically noted that they didn't include air pollution in their main model. Air pollution is another environmental factor that has been linked independently to various health outcomes, including mental health. However, they did reference other studies conducted on temperature and overall mortality in Thailand, which found that the temperature association remained robust even after adjusting for major air pollutants like particulate matter. This suggests that the temperature link they found might be operating independently of air pollution, at least to a large extent.
Okay, so wrapping it all up now, what is the main actionable conclusion we should take away from this deep dive into the research?
I think the key takeaway is really clear. There appears to be a significant and substantial link between higher ambient temperature and increased suicide risk in Thailand's tropical setting. And the study estimates that roughly a quarter of suicides in the provinces they studied may be statistically attributable to temperature exposure, with hot temperatures being a particularly large driver of that burden.
And that age finding is a critical piece of that overall message.
Absolutely. The finding that the 0-64 age group appears to bear a statistically significantly higher temperature-related suicide burden is a crucial insight. It really points towards potential vulnerabilities concentrated in the working-age population, possibly, as the authors suggest, linked to occupational exposure to heat.
And this has very concrete implications for policy, doesn't it? Especially given the ongoing climate crisis.
It really strongly underscores the urgent need for public health strategies to start seriously integrating climate considerations, specifically heat, into mental health promotion and suicide prevention efforts. As temperatures continue to rise, especially in already warm tropical regions, addressing heat as a potential risk factor becomes pretty essential, not just an optional extra.
What kind of proactive steps or interventions does the paper suggest might be needed based on these findings?
Well, the findings support the integration of climate-informed strategies with existing public health measures. This could involve things like enhancing or implementing heat health warning systems that explicitly include advice on potential mental health impacts, not just physical ones like heat stroke. It could mean offering targeted mental health support services, maybe outreach programs during periods of extreme heat or during the hottest seasons. And perhaps even considering workplace safety regulations related to heat exposure, particularly for vulnerable outdoor workers, thinking about that 0-64 age group finding. All of these need to be woven into broader climate adaptation plans for cities and regions.
And more research is needed too, presumably.
Oh, definitely. The authors strongly call for further research. They emphasize the need to see if these findings hold true in other tropical countries, given that we've seen regional differences are apparent in the literature. They also stress the importance of actually evaluating the effectiveness of any interventions that are put in place to try and mitigate this temperature-related suicide risk, and ensuring these interventions are culturally appropriate and contextually relevant for the specific populations they're meant to serve.
Yeah, it sounds like really understanding the specific interplay of the environment, the sociocultural factors, the economic realities in each region is absolutely key to developing strategies that will actually work.
Exactly. What works perfectly in Bangkok might need significant adaptation for rural Chiang Mai, let alone for another country entirely. Local context matters profoundly.
Okay, this has been a truly eye-opening deep dive. It really challenges that initial, maybe simplistic assumption that temperature might be too simple a factor for something as complex as suicide. Instead, it provides compelling evidence that it is indeed linked even in tropical climates and potentially contributing to a substantial portion of suicides, especially, it seems, among younger working-age adults.
Yeah, it powerfully illustrates how our changing environment can impact our mental well-being in ways that we are only just beginning to fully understand and, importantly, quantify.
So here's a final thought for you, our listeners, to take away and maybe ponder. Given the significant burden of suicide potentially linked to temperature nearly a quarter in the study region, particularly linked to hot temperatures and possibly related to occupational exposure in younger adults, how fundamentally might our societies, especially those in already warm and rapidly warming climates, need to rethink things like urban design, workplace practices, maybe even social support systems, not just for physical health, but specifically with mental health and suicide prevention in mind? What does this mean for ensuring access to green spaces in cities, for building codes that promote cooling, for adjusting working hours during extreme heat waves, or for providing accessible cooling centers and proactive mental health support during the hottest months? It really forces us to look at climate adaptation not just as an environmental issue or an infrastructure challenge, but as a direct and urgent mental health imperative.
A really complex but absolutely essential challenge for the future.
Thanks for being with us today. Don't forget to like, share, subscribe, and tap the bell to keep the good vibes going. Let's join into healing our little world one step at a time, together. And all this is Tangerine Planet. Until next time.